Okay, we then have organizers. So organizers are just a couple of various options or containers that are basically used to hold our intracanal instruments, like our reamers, our headstrom files, our K files, flex files, whatever then the practice uses. Ne? So some of these can be sterilized, others are actually even large enough that they can actually even put stoppers or your measuring gauges on them, so that they just allow for ease of use. So those are our organizers. And then from there we also then have rubber stops. So rubber stops are also known as file stops, endo stops, or markers. They're basically placed on reamers or even K files actually, to mark the length of the root. So obviously you would have taken your periapical x-ray, then you would have noted that maybe it is 26 millimeters, but then your next largest file is actually 30 millimeters. So we are actually going to measure on our endo ruler 26 and actually place a stopper there. Then we're going to file based on the working length or the length of the chamber that we are actually trying to clean. So these are small circular discs that have pre-punched holes in the center. So in the pre-punched hole basically is where you're going to insert your file or your reamer or whatever you will be cleaning with, and they tend to have different colors, so you can also just play around with those colors. Okay, then from there we have our Gates Glidden drills. So our Gates Glidden drills have little latch-on attachments. So they are basically used with our slow hand pieces or on slow hand pieces. So they are long shanked and elliptically shaped with blunt football-shaped ends. But you'll see that in the diagram that I'll provide for you guys. And then from there they have 6 sizes marked near the notch of the shank. So there are 6 different sizes. So the first one will have, or Gates Glidden number 1 will have 1 stripe at where the latch is, where we insert into our slow hand piece, whereas Gates Glidden number 2 will have 2 stripes, number 3 will have 3 stripes, all the way up to number 6. So Gates Glidden number 1 is basically the equivalent of a size 50 K file or a 50 diameter K file, but then the sizes decrease as you increase with the number of stripes. Personally, where I went to study dentistry, we didn't like going, or they never made us start with like your number 1 and number 2 files. We played more along Gates Glidden number 3 and 4, so as to not cause any fractures in the teaching process. So there they are. Okay, so here's a picture of the stripes. So they decrease in diameter when you increase the number of stripes on the Gates Glidden drill, and they're basically used in the upper portion of the canal to prepare the opening access by removing obstructing dentine. So you'll find that the moment after you drill all of those caries, you'll still find that there's dentine that's actually obstructing you from getting into the canal. So that's when we make use of the Gates Glidden drill in an outward motion, but the drill itself works in a clockwise motion. Okay, yeah. From there we have piezo reamers. So piezo reamers have parallel cutting sides. They are not elliptical the way Gates Glidden drills are. Piezo reamers are also used with, they have a latch attachment, so you actually place them into slow hand pieces as well, and they are supplied in various sizes. So we also have piezo 1 up until piezo 6. The piezo 1 starts with about 0.70 millimeter, with piezo number 2 then increasing by 0.20 millimeters, and then all the way up. Okay, and then as well, in addition to their various sizes, some of them, sometimes they come with safe tips and others do not come with safe tips, depending on the manufacturer that you actually got your reamers from. So reamers basically are used to prepare canals for the post and to reduce curvature of the canal orifice for straight line access. So when we're preparing for a post, normally it's on an endodontically treated tooth, so we're actually trying to remove that gutta percha that we had placed, as well as the intracanal medicament that we had placed out of the canal for us to actually place our post. So effectively the reamer tries to remove the material that we had placed previously in an endodontic treated tooth. So then from there we have lentulo spirals, which are long, twisted and very flexible wires that are used to spin the root canal sealer or the cement into the canal. So they actually spin that material into our canal, and then they are used again with slow hand pieces, and they have latch attachments. I think more than anything, ladies and gentlemen, the reason why all of these drills are used in slow hand pieces is that slow hand pieces, they are slow like the name says, but they actually allow for more control and more precision as you are working the in the canal of said tooth. So yeah, think of it in that regard. So we want to actually control our instrument and to allow for a good result at the end of the day. Okay, so with our instruments, we also then have our endodontic spoons. Né? So they are nice and long and basically are designed to actually reach the coronal part of our pulp. Né? So then they then remove temporary restorations, they remove debris as well as necrotic tissue and deep caries. So that's basically the function of our endodontic spoon excavators. These instruments are very important, ladies and gentlemen. So as your slide says, that they are double-ended and they are long shanked, like I said, to reach the coronal aspect of your pulp. And then from there they remove caries, pulp tissue, as well as temporary cement. From then on, we have our very stiff endodontic explorer. So this helps just locate the opening of the canals, because those openings are tiny. They are the size of a pin. So at least once you actually get your explorer in there, you know that you've at least found one of the canals, if I can put it that way. They have long tapered ends and they are double-ended with sharp pointed ends. Né? Okay guys, we have our endodontic spreaders. So our endodontic spreaders, basically they are used to laterally condense our gutta percha. So after we've opened up our pulp chambers, we've removed all the necrotic pulp, so now it's like it's empty. So the gutta percha, ladies and gentlemen, is basically the filling material that we place into the pulpal chambers after we have cleaned and removed all the necrotic debris. So basically endodontic spreaders are used to laterally condense, so you're basically packing the gutta percha into your pulpal chambers. So they are similar to pluggers and are batch pointed at the tip. Like I said before, they condense the gutta percha into the sides of the canal. We then have our endodontic our endodontic pluggers. So they are used to condense our gutta percha. So you basically just use them to condense the GP, as well as basically create space for even more gutta percha material to be placed into the pulpal chamber. You need to place as much of that material and the intracanal medicament, or cement, to actually make sure that that pulp is nice and well fitted. Né? So our endodontic pluggers are flat ended. We then have our Glick 1 instrument. So the Glick 1 instrument is used to remove the excess gutta percha from the coronal portion of the canal. So whatever excess material a dentist has, we then use the Glick 1 to remove that excess. And then in addition to actually removing the excess, it is also used to condense our gutta percha into in the canal opening, essentially. So then from there, we have a little dental check that you can use. And then from there we have paper points. So paper points have different sizes, ranging from extra fine all the way up to coarse. So paper points, ladies and gentlemen, are used after we've opened up our canals. Now we've cleaned and we've widened and we've shaped our canals. So now we actually have to make it dry before we actually place the gutta percha. Okay, and in addition to that, make dry and like sort of clean at the same time, but mainly to dry our canals. So like I'm saying, it dries canals, it places medications, and it takes cultures wherever necessary, especially maybe in research where you need to test the type of tissue that you actually find in the canal. So that's what paper points do. We try to actually keep our canals dry before we actually place our GP, as well as its cement, because water can have adverse reactions on those materials. So then we go on to our gutta percha. So our gutta percha obturates, it basically fills the canal. So that's essentially its function. It is heated and placed into canals. This, ladies and gentlemen, depends on how you were taught. For example, where I studied dentistry, we do not heat our gutta percha, because the argument is that heating makes the canal shrink, and then it makes it prone to sensitivity. You remember the thermal sensitivity that we talked about earlier on? Yes. And also the argument is that then it doesn't adhere properly once heated to the surrounding tooth structure, that is basically the tooth. So it just depends, but some people heat it, others don't. I'm one of the people that does not heat my GP. And then from there it is condensed with spreaders and pluggers. And then essentially, like I was saying, you're basically going to place a medicament or your cement around your GP. So you're actually going to apply the cement onto our GP before we actually place it into our canal. Again, depends where you were taught. And then from there, the removal of the apex and infection surrounding the tooth. So yes, so by placing GP as well as that cement into the canal, we make sure that anything on the coronal aspect of the tooth as well as on the periapical aspect of the tooth does not get into that pulpal chamber to actually create another infection, thereby causing more pain to the patient on that particular tooth. Okay, then we have our irrigation solutions. So irrigation solutions we basically use with our K files, ladies and gentlemen. So you actually place the irrigation solution into the pulpal chamber before you actually go in with your files, because it helps ease the movement of the files, and it actually removes and kills bacteria and necrotic tissue that you actually find in the pulp. So irrigation solutions are very important in endodontics. So root canals are irrigated frequently to remove debris. So we're going to clean for as long as every time we remove our file and we find some form of tissue, then we know that the pulpal chamber is not as clean as we want it to be. So we're going to keep getting in there with our files and our irrigation tissue, irrigation solution. So irrigation solution first, and then you're going to make use of your file to actually clean that pulpal chamber. So then you can either make use of sterile water, which I hardly have used, as well as sodium hypochlorite. Sodium hypochlorite is jig, ladies and gentlemen. So some practices you'll find that they use jig or a product known as Milton to actually irrigate those pulpal chambers.